Hello students, today we will start the drug and dice. In the last lecture we have discussed the syllabus of the drug and dice. First point of this is the parental route of drug administration. Drug Drugs are the nothing but the chemical substances which are intended in the body for required pharmacological actions or for required therapeutic actions. We use the drugs so as to fight against the diseases or cover body from these diseases. These are the drugs. The drugs are going to be administered in the body so that we will get the required therapeutic actions. So there are different ways to administer the drug in the bodies. Oral route of administration is also one of the way to administer the drugs in the body. So another one is the parental route of administration. Some are the anal route of drug administrations. These are the different way for the drug administration in the bodies. The parental route of drug administration is defined as the administration by the injection which takes the drugs directly into the tissue fluids or blood stream without having to cross the intestinal mucosa. And these parental route of drug administrations are direct route of administration giving the maximum results in minimum times. If you compare this parental route of drug administration with the oral route of drug administration, then we find that oral route of drug administration takes more time and less therapeutic actions, and these drugs are going to be absorbed from the intestinal mucosa. Due to this, the required therapeutic action will be the less. But in parental route of drug administration, as the drug administered in the blood, and blood are the barrier with tissue fluids, these are directly reached to the required site so that we get the most beneficial actions of the drugs. We will discuss the advantages of this parental route of drug administrations. We know that as this is the action is the faster and definite, gastric irritation and the vomitings are not provoked, can be employed even in the unconscious, unopened and vomiting patients. No chance of interference by food or digestive juice or liver bypass. The disadvantages of this drug is that the preparation has to be sterilized. This is the main disadvantages, because if we enter the unsterilized liquid into the body, it will cause the more damage to the body. Preparation has to be sterilized. It is the costlier, as it is passed to direct into the blood. It is costlier. Technique is invasive and painful. Technique is invasive and painful because as we use the needles is painful. Some patient likes and some patient cannot bear the pain also. So it is a painful and costly here also, because it required stents, injections. Chances of local tissue injury is also takes place, because as we use the needles, it rupture the tissues and rupture the muscles also. It will use in the diabetic patients. So diabetic patients can be hurt by this. If a patient having the another diseases, the diseases is also risky for this. If we reuse these needles for other patients, the contaminations can be possible. So there is a lot of disadvantages of this parenteral route also. So the friends, we use this day-to-day life. We use the parenteral routes, because in sometimes bodies is not in position to take drugs by oral route of drug administration. At that time we use the parenteral route, because in the oral route of drug administration, drugs come into the body and from then it enter into the stomach. But if patient having the vomiting problem, at that time drug cannot be absorbed in the body and patient cannot get the required therapeutic actions. So it is in that case patient not get the proper therapeutic actions. So at that time these parenteral route of drug administrations are used. Okay friends, in the next lecture we'll discuss the head and toys. Thank you.